What is endometriosis and the symptoms? Hello and welcome. So, have you just been diagnosed with endometriosis, or perhaps you've known for a long time, and you're trying to make sense of it all, including wondering what it actually is and what the symptoms are? Or maybe you've read a few things online and you're wondering, maybe I have endometriosis after looking up the symptoms on Google. So let's discuss what endometriosis is and and the symptoms on this Instagram and Facebook Live today. Hello, I am so thrilled to be here. So that for those of you that don't know me, my name is Michelle Cooke. I'm a period and hormone naturopath. I'm also an emotion release technique practitioner and also a natural fertility educator. So I help women struggling with their menstrual cycles experience easy, pain-free periods, hormone balance, and emotional well-being. So I'm the founder of a clinic called Reproductive Wellness, which is based in Melbourne, and I see patients both online and face-to-face. So if you have any questions or comments as we go through the live today, be sure to pop them in the comments box down below. And if you're watching live, be sure to, and even afterwards, be sure to hit the love hearts and the thumbs up so that I know that you've enjoyed the content today. What is endometriosis? So it is when tissue from the inner lining layer of the uterus is found outside the uterine cavity. So endometriosis actually comes from a Greek word, or Greek words rather. So endo means inside. So endo means inside, and metra means uterus, and osis means disease. Okay, so it can be found in or around the ovaries, this endometrial tissue. It can also be found in the fallopian tubes, the uterosacral ligaments, the gastrointestinal system, so particularly around the bowels, the urinary tract, such as the ureter, the bladder, and the urethra. And less commonly, it's found in the pericardium, which is the sac that surrounds the heart, so it actually protects the heart there. Then it could also, like less commonly as well, it can also be found in the pleura or around the central nervous system as well. It's important to remember that this tissue responds in the same way as your uterine lining that's found inside the uterine cavity. So the tissue that's growing outside of the uterine cavity is also growing in response to estrogen, which commonly is actually preparing your lining for implantation for an egg, so that if conception does arise, it's able to implant into that nice juicy lining. And then if pregnancy doesn't occur, that results in a bleed. However, instead of the typical scenario of what would happen, so typically, within the uterine cavity, inside the uterus, the bleed is able to obviously vacate the body through the vagina, but it's not able to do this when it's endometrial tissue that's located outside the uterine cavity. There's nowhere for it to actually go. So this tissue and blood from the endometrial tissue has nowhere to go and it's trapped in the body. So this is what causes a lot of the inflammation and pain, etc. So complications of endometriosis. So adhesions is one of them. So they're bands of connective tissue and they may form due to the endometrial tissue bleeding. Remember, that's bleeding in response to estrogen through that menstrual cycle. And it's bleeding into the surrounding space outside that uterine cavity and then forming a band actually connecting two organs together. So it can be quite painful. The second complication that could arise is ovarian endometriomas. So these are also known as chocolate cysts. That's another name for them. And they can form inside the ovaries. So they're more common apparently in women in the left ovary as opposed to the right, just in general. But of course you can still get it in the right ovary. That's still a thing. And these cysts are different from your typical ovarian cysts because the endometrial tissue actually bleeds inside this cyst. And it's also referred to as a chocolate cyst because it's actually old blood that's found inside that cyst. It is possible, but it doesn't always happen, but it is possible for these to rupture, which means that they break open or burst. So the third complication could be pelvic cysts, and the fourth complication could be bowel perforation. Okay, so that leads to peritonitis, which is an inflammation of the lining of your abdomen or your tummy. And that's just to name a few. There can be other complications as well. Stages of endometriosis. So there's stage 1, which is minimal. So there can be a few superficial, so on the surface type endometrial tissue present. There can be stage 2, so that's a bit more mild. So there's more and slightly deeper endometrial tissue that's present there. Stage 3, that's classed as moderate. So there can be many deep endometrial tissue. There can be small endometriomas, like I talked about before, and that can either be on one or on both of the ovaries, and some adhesions. So that's that connective tissue joining, commonly joining two different organs together. Very painful. Then there's stage 4. So stage 4 is severe. So this is where there's many deep endometrial lesion tissue. There's large endometriomas as well, so those cysts, which can be found on either one or both of the ovaries, and many thick adhesions, so that connective tissue band that's joining to the two different organs in the body. So yeah, it's pretty extensive, that type of one. I have seen that in a patient before, and yeah, it's just shocking to see, when they've got the laparoscopy done and they've got the photos taken, how extensive it can really get. It's, it's very full on. Okay, symptoms of endometriosis. So some of the symptoms will actually depend on where the endometrial tissue is. So where it's located might determine these symptoms as well. So it's important to know as well that there are actually some women that are asymptomatic, which means that they don't have any symptoms, while the next woman might be suffering profusely with very debilitating symptoms that I'll discuss next as well. So it's really variable what a woman can experience when they've got endometriosis. No two women are alike in terms of having that. So let's talk about period-related symptoms. So they could be spotting after sex. There could be metrorrhagia. Sorry, I always have trouble saying that one. So abnormal bleeding between your periods. Normally, you shouldn't have bleeding in between your periods. That means that, something's not quite right there. Spotting prior to your period is another one, because commonly there's estrogen dominance associated with endometriosis, and therefore low progesterone. When you've got low progesterone, that usually leads to spotting. Spotting can be caused by other things as well, though. Heavy periods, so you could have a normal period length, but it could just be quite heavy. So a heavy period is typically 80 mils or more over the whole duration of that period. Or your period might have kind of what seems to be a normal flow, but it's going for an extended period of time. So a period should typically go from 4 to 7 days. If it's going beyond 7 days, then that, might look like a heavy period as well. Small or large clots with the bleed, Mittelschmerz. So this is a German word and it means middle pain. So typically it would occur with ovulation, because that would typically occur in the middle of the cycle. Dysmenorrhea, so that is painful periods. Now, one thing to note is that quite often the pain doesn't match the severity. So you could have a woman that has stage 1 endometriosis and severe pain, and you might have someone that's got stage 4 and yet they don't experience, they experience minimal pain or maybe not much at all. So it can be really varied. So you can't really judge the pain according to what stage the endometriosis might be. And there can be cyclical pain as well. So what about reproductive related symptoms? Let's discuss them. So there could be vaginal thrush, particularly prior to your period. There could also be, interestingly enough, hot flushes. So that could be happening prior to your period, when you ovulate, or when conception takes place. There can be fertility issues. There can be dyspareunia, which means painful sex. And there can be chronic pelvic pain and or hematuria. So hematuria is basically blood in your wee. And let's talk about the digestive symptoms. So this is something I see a lot of. And obviously the above symptoms as well, but yeah, this is something that I see too. So things like vomiting, nausea, bloating. So bloating particularly around the abdomen or tummy. Diarrhea, so particularly when you've got your period, and that's usually due to the prostaglandins and a lot of pain and inflammation there. There can be constipation, particularly before your period's due. There can be flatulence, so essentially farting. There can be dyschezia, so difficulty doing a poo because it's quite painful. There can be hematochezia, which is basically fresh red blood coming through when you're actually doing a poo. Okay, nervous system symptoms, let's talk about those. This is another one that I see commonly, not all the time, but I do see it. So there can be dizziness, there can be women that actually faint, or maybe they're feeling faint. There can be chronic fatigue, and there can also be headaches as well. So urinary tract symptoms. So there can be UTIs, so urinary tract infections, especially prior to your period. There can be dysuria, so this is pain, burning or stinging when you do a wee. And we can't forget the emotional and mental symptoms, and this is due to so many different reasons, but things because of the hormonal imbalance. It can be due to being in pain all the time. It's very taxing on your quality of life. And inflammation, lots of different reasons. So typical things that I see would be anxiety and depression. There can also be musculoskeletal symptoms, so things like pain in the thighs and legs, And also back pain, that's another one that I see very, very commonly. So I'm just going to check if there's any questions about that. It's just a nice, short and sweet one today. But I really, really enjoyed talking about that topic. It's probably one of my favorite things to treat because you can make a massive difference to someone's life and their quality of life when they have endometriosis. It's just phenomenal, the things and the changes that can be made with natural medicine and diet changes and lifestyle changes. It makes such a huge difference, and it's probably my favorite because the change is so radical for them. And yeah, they just get their life back and they get to feel like their normal self again, and it's just so rewarding. So if you would like help with your endometriosis, or you think that you might have endometriosis, I would absolutely love to help you. So if you're watching on Instagram, there's a link in my bio, so go ahead and book an appointment. If you're watching on Facebook, I'll pop the link down below for you. If you're watching on YouTube, the link should be in the description there. So yeah, make that first step. Make that step towards changing your life in a positive way. Okay, just a reminder that all my videos are on my blog. So if you've missed any videos or you're curious to what juicy topics I've talked about in the past, they're all there. So if you go to reproductivewellness.com.au/blog, they'll be there with a video at the top and the written description underneath for you. So I would like to thank you so very much for watching. I appreciate you. I appreciate you showing up and listening to what I have to say. If you are watching on my YouTube channel, be sure to like and subscribe and hit the bell icon so you don't miss any future videos. And FYI, I am here every Wednesday. It's actually 6 p.m. now. I've made it a little bit earlier. So I'm here every Wednesday, 6 p.m. At the moment, it's Australian Eastern Daylight Saving Time, but usually it will be Australian Eastern Standard Time, okay? And I'll be talking about everything related to women's health, periods, menstrual cycles, and all that type of juicy thing, hormone balancing. So I really, really look forward to seeing you next Wednesday, and I hope you have a fantastic evening. Thank you so much for joining. Bye.